welcome back to the show. If you just tuned in, we were talking about music therapy and dance movement therapy. If you just heard the theme of Good Morning Sri Lanka right now, that is therapy for me, because it kind of gets me excited just before the camera comes on, because I just feel like all motivated to smile bright and try and give you justice. But anyway, talking a little more further on this topic, I'm going to point this next question to Dr. Samitha Siritunga, who's here with us. And what I want to ask you, Doctor, is now if you take music therapy, how can you relate it to a medical sense?
Yes, usually what music therapy, what people think as music therapy is, there are so many categories, elements of music therapy also. Listening to music, playing, imagery, and certain things, the music discussion, lyric discussion. So there are so many categories, because I think you can see now it's very complex actually.
Okay, I'm just going to stop you there, Doctor, because I think you've given us a track for the show, something you've done. So let's listen to that while we discuss it as well. So we can listen to it now.
Yes, of course. And the music that usually what we are talking about, listening to music, it goes through our ear, and then it goes to the brain, and there are processes there, and it acts on our nervous system, and it acts so many places in the brain, and it helps release so many chemicals in the brain, and all these chemicals, they help us to for motivation, control our emotions, for improve our thinking patterns and so on, and also while acting on the nervous system, especially autonomic nervous system, it helps to reduce there should be a balance in sympathetic and parasympathetic nervous system. There are two kinds of nervous system, and if you relaxing music, it can improve the parasympathetic nervous system. Sometimes people may not understand what is parasympathetic. It helps to reduce heart rate, blood pressure, blood glucose level, cholesterol levels, like that. And see, if you really listen to that type of music, now if it helps to reduce blood pressure, heart rate, cholesterol, blood sugar levels, if you have something like that, if you have increased blood sugar, say diabetes, you can improve your diabetes state. And if you are having increased blood pressure, if that means if you are a hypertensive patient, you can improve that your status. And you are having some kind of heart disease, you can get some improvement, because with my experience, it can be related to any disease from head to toe, because it helps to improve our immunity, even in cancer patients. Cancer patients also can be treated with the music, and even you think some kind of psychiatric illnesses. Most of the time in the world, but rather than using music as a treatment for physical illnesses like heart disease, diabetes, hypertension, cancers, most of the time what they use music as a treatment, especially for people who are having some kind of problems in nervous system and psychological illnesses. And if you think any illness, music is there.
Well, actually, Doctor, listening to you while listening to your music also is quite soothing and quite nice. Won't you agree, Dr. Priyashni?
Yes, I do agree with him.
Vinod, if I'm to point this next question out, I was just discussing with Dr. Samitha about the medical aspects when it comes to music therapy. Now, I know you aren't a doctor who practices in terms of a medical aspect, but when it comes to dance movement therapy and stuff, how far can you use it to help people's physical and psychological conditions?
Yeah, it can be used to a great depth, and it has, like research has shown that you can use it with people with autism, with ADHD, with schizophrenia, and with sensory impairments. Personally, I have some experience working with people with visual impairment. During my studies, I worked with a group of elders who were visually impaired. It was a community program in the Royal Opera House in London, and there essentially what you realize is when you're working with people with visual impairment, it's very, very important to articulate because you have to use the other senses. So they are listening to you very carefully. So when what is left, what is right, what is up, what is down, and then you realize what is their perception of front could be very different to what you think is your perception of front. And then also you have to use touch, because sometimes you're saying, okay, we need to move in a certain way, and or you want to bend down, and they don't know what that means. So you can either manipulate them by using touch, or you can ask them to come and touch you so that they see where it's supposed to go. And then they develop a sense of awareness of their body, a sense of freedom of how they can move, and the therapy sessions itself provides them a safe space to move without knocking onto things. And like for example, that space was just a blank huge studio space, and you can just move freely, and I cannot even empathize about how much freedom that would have given them. And they keep coming back to learn essentially ballet, but it is therapeutic. So that was just one example from my experience, but like what you said with using rhythm development for young people with ADHD, and for example autistic children, they have very bound movements sometimes, or ADHD people are very hyperactive and they use a lot of space. So in a movement session you would try to contain that movement and try a different way of moving using space, or the rhythm movement helps them to improve concentration and kind of also increase concentration by adding longer and longer rhythm patterns. So, and also improving memory, body memory. So many things can be used with movement. So I could go on.
Well, we'd definitely like you to go on, because we are kind of learning from what you said. But now, just talking a little bit more about dance therapy per se. Now, dance to me is the fact that you move according to a beat of sorts. I'm not a dancer myself, I'm not a choreographer in that sense, but this is the kind of understanding that I have. Now when you use this as a therapy, does it necessarily mean that it's about moving with rhythm, or is it just movement in general? Yeah,
so that's I think very important, because the danger when you say dance therapy, what people would imagine is, oh, I can't dance, I need to learn a certain number of steps, be able to move to a rhythm, and therefore I'm never going to go for this. But it's actually essentially movement, and human beings, we all can move. We have a body and we have legs, or we don't, but we can move, and this is what is important, that in dance movement therapy, it's not really about learning a codified technique and perfecting a technique or performing it. It's about the process, and it's an expressive therapy, so it's the creative process. So how, say for example, a very, very simple example, somebody with depression. So they would not use the space so much. They would their posture would be quite low, and the eye contact would not be established with anybody else. But then through an improvisation session, you could again help them to use the space more. How would you establish eye contact? Maybe you have you change the posture, and that is essentially already movement. And then when you start to, the hypothesis that the movement and the mind is connected, so when you start to move and more than you normally do, and then you're standing straight, automatically, if you're doing it over a period of time, you start to feel better. So it's not possible to jump around and feel depressed somehow. It's so that's how it works. So it's not really dance, but you can use dance styles for dance therapy, and it's essential that the therapist is flexible to move the way the person is moving, because you have to mirror what the person is doing in order to be able to empathize, in order to be able to feel what the person is feeling and show it back to them that, okay, this is how you're moving. So it's very important to be able to be flexible, but it's not necessarily about learning a dance to a rhythm, but that also has its benefits, like the discipline, the self-esteem you would get by having to have performed or established a certain goal. So yeah, I see. Well, it's definitely nice to see you all motivated about the topic. Seems that therapy is definitely helping you individually a lot as well. Because we hardly come across really lively people in general, and
Seems like you've got it all going on. Dr. Priyashni, I feel like I've left you out of the conversation.
Oh, that's fine.
I'm really sorry to do that. I'm going to ask this next question from you.
Okay.
Just to put you on the spotlight now, what do music therapists really do?
Well, usually, I'll just tell you what happens in the West, because I'm not so familiar what really happens here. But usually what happens there is, when a doctor and a nurse goes, a music therapist goes with the team, and they will look into the patient's requirements, and then will map out a little, plan of what they need to do, and what are the objectives of doing this, and what are the goals that they need to accomplish through this. And then the music therapist is given the task of doing whatever she's supposed to do. So it's never like the therapist never does something on their own. They're always consulted by a doctor, and they are advised, and they're always supervised quite closely as to what they are doing with the patients.
I see. And Dr. Samita, on the same lines, like for example, okay, if you have a emotional problem, or if you're suffering from depression, or if it's something to do with something more than just physical, sometimes you would go consult a psychologist, and if the psychologist feels like it, he or she may refer you to a psychiatrist to get medication and stuff. But how is it when it comes to music therapy? Is it used with medicine as well, or is it just music only?
Really,
what is it like?
Music is considered as a complementary medicine, complementary therapy. Complementary in the sense you have to use music other than other medicine, with other medicines,
right.
Because you can't use only music for treating patients. Therefore, I agree with you, Priyashni, because it's a teamwork really, and music therapist is given a task, and according to that task, according to the patient's requirements about the patient's disease patterns and everything, music therapist have to design his treatment plan, and according to that, she or he, the music therapist, is treating the patient. I want to add something for your description, and other than all these things, music therapist, this is my view, you may not agree with me, and this is because I am looking at a point of view of a medical doctor as a practitioner, and we usually prescribe medicines after looking at the cause of the particular illness. Therefore, and in music also, we need to look at the cause for this particular illness, say for heart disease, because that's my familiar area, because I have done my MD thesis in music therapy and heart disease. How can music affect on heart diseases? And we need to look at the pathophysiology, say simply cause for this heart disease, with the problem in the atherosclerosis, that's cholesterol deposition, blood clotting, problems in arteries, and so on. And we need to design our music according to that, because we prescribe our drugs also according to combat with all these problems. Therefore, we need to design all these according to the patient's requirements and so on, but it's a teamwork anyway. That's yes.
I see. Well, I'm sure you've been learning a lot about music therapy and dance therapy and how it really helps people. Well, I've definitely been learning on the process as well. But we're going to go in for a short commercial break, but before we do, I just want to remind you that you can give us your feedback and tell us how we're doing on the show, and you can of course log into Facebook, which is our URL is www.facebook.com/goodmorningsrilanka. That's www.facebook.com/goodmorningsrilanka, and don't forget to like the page, or you can send us an email. That's mtvsports@maharaja.lk. That's mtvsports@maharaja.lk. So we're going to go in for a short commercial break, and when we do come back, we're going to speak to a wonderful guests in the studio this morning, and we're going to talk a lot more about this topic. So be right back.